Hi, my name is Alana Patrick, and I'm going to do an examination of my patient's lungs and heart. First, I'm going to begin an inspection of his chest. I'm going to visualize the AP versus the transverse diameter of the chest, which it appears to be normal in the fact that the AP is less than the transverse. I'll also inspect the skin, which appears to be normal for ethnicity. You can also check the nail beds to look for signs of cyanosis or pallor, which I don't see any. His nail beds are healthy, good cap refill. They don't appear blue or any other type of discolored. Um, also, I'm going to palpate the posterior portion of his chest, which I don't feel any abnormalities, any lumps, any abnormal movement of his ribs. His chest is also symmetrical. I see an even symmetrical rise and fall of his chest with normal breathing, as well as the anterior portion of his chest feels normal. I don't feel any crepitus. Um, like I said, everything upon examination so far is within normal limits. Um, I'll move on to an inspection, or sorry, auscultation of his breath sounds. Also wanted to note, as far as percussion, you can percuss the posterior portion of the patient's back or chest to check for diaphragmatic excursion. Um, but then I'll move on to auscultate his lung sounds, which I'll begin over the trachea. Sir, can you just kind of take a few deep breaths in and out? So over the trachea, we'll hear the bronchial sounds, and then moving down anteriorly, we hear clear bronchiovesicular sounds. You keep moving down through the intercostal spaces. I do note that on the right side, to hear the mid-lobe, you listen laterally. And then moving to the posterior portion where we can hear the best sound of the vesicular lung sounds in the bases. Deep breath. No. And as I listen, I don't hear any friction, rubs, no wheezes, bronchi, crackles. They appear or sound to be healthy and clear. Um, Moving on to inspection of my patient's heart, I'll look and see if I can visualize his apical pulse, and depending on the patient, I'm not able to actually visualize it, but I can palpate it, just right here at the apex. And then I'll palpate, and with my other hand, I'll palpate the carotid pulse, in which it should synchronize with the S1, which it does. Let's check on this other side. Okay. Then I will auscultate. And this we'll be listening, checking for a normal S1, S2, making sure that we don't hear any murmurs, clicks, any adventitious heart sounds, also any type of gallops, S3, S4. So I'm going to inspect the aortic, pulmonic, second pulmonic, tricuspid, and mitral valves, which, like I said, I don't hear anything abnormal. The valves sound sound as though they're opening, closing normal. I don't hear any murmurs or any other adventitious sounds. In regards to percussion, it's not very common because typically a chest radiograph is used to determine the size of the heart. But if that wasn't available, you would be able to percuss around the heart to check for the size, and it could give you a rough estimate of the size. Thank you very much, and this concludes my inspection of my patient's chest and heart.